Hi, my name is Joey Franchini, student physical therapist at the University of St. Augustine.
I'm Bill. So, dog?
Your name is Bill.
Sure am.
How old are you?
I'm 65.
Okay. What brings you in here?
I've had some issues with my left elbow.
Your left elbow. Tell me more.
Well, I was playing golf a couple of days ago and I had a sharp pain in my elbow.
So you said a couple days ago?
I did 3 days ago to be exact.
3 days ago. Okay. So what you said it's the left side?
Yep.
Happened 3 days ago. Has it gotten better or worse? The same since it happened 3 days ago?
It's been about the same.
Same. Could you point to me where you have any problems? So like the outside, like the outside aspect?
And here. And the back.
So outside and the back of your elbow. Okay. All right. So it's gotten the same. Have you?
Oh, it's worsening. It's getting worse.
It's getting worse. You changed your mind.
It sure is. It's getting worse. Yeah.
Okay. Have you noticed any warmth or swelling?
Yes.
Okay. Swelling and warmth. Okay. You said you're 60. How? You said you're 65.
Correct.
Do you still work or are you not working
No,
anymore?
I'm retired.
You're retired. Do you have any hobbies?
Golfing.
Golfing.
I golf a lot, and I like to swim at the pool. At the local pool.
How is this affecting your ability to golf and swim?
I can't do either one.
You cannot golf or swim.
I'm even having trouble holding my coffee cup in the morning.
Okay. And then you having pain while holding the coffee cup, or can you not even hold it at all?
Pain.
Pain with holding cup. Okay. Let's see. So what makes it worse? You said holding a cup makes it worse, but is there anything else that you can do or you have done that makes it worse?
I mean, it's just painful throughout the day, whenever, like, just doing activities makes it painful.
Okay. What makes it feel better?
Not doing anything.
So rest? You been taking any medication at all for it?
No.
Okay. You take medication for anything else?
Not that I can recall.
Okay. If you were to grade your pain, 0 is not there, 1 is just barely there, and 10 is so bad you have to go to hospital. How would you grade your pain right now?
Can't tell you, but I can tell you it's about a 9 out of 10 when I play golf.
Okay, so at its worst, it's a 9 out of 10. What about its best?
Can't tell you.
No information. Assuming. Interesting. Okay, so then so it's getting worse. Rest makes it feel better. Throughout the day, it hurts. Have you ever had a prior injury to this to your elbow before?
It doesn't say rest makes it feel better, just so you know. I said I am assuming, but it doesn't say anything on here makes it better.
Okay. Okay, so have you had a prior injury?
No.
You had a prior physical therapy treatment at all for anything else?
No.
Have you, what time, is there a specific time of the day where you feel the pain is worse?
No.
Morning,
No.
at night? Okay. Have you had any like unexplained weight loss?
No.
Or gain, or any stomach issues like gastrointestinal issues, any issues using the bathroom, any loss of feeling while using the restroom?
No.
Any night sweats, bladder dysfunction, night pain?
No.
Okay, lost track of my thought. Okay, so then next question. So you said before this happened, you were able to golf and swim without pain,
Yeah.
and you were able to do, things like holding a coffee cup without pain. Is this prohibiting you from doing anything else, like at home, like, in the shower, going up and down the stairs, anything
No.
like that? Okay, and then right now you're having issues, like I said, with all those things. What are your goals for physical therapy?
I would like to be able to golf and swim.
Golf and swim. Got it. Perfect. Did you have a questionnaire that the
No.
receptionist gave you? Okay. Let's see. Have you seen a doctor?
Yes.
What did the doctor have to say?
And MRI and no results yet.
Okay. So you got an MRI, but there are no results. Okay.
Correct.
Are you having any trouble sleeping?
No.
Okay. Are you feeling any burning, tingling, or numbness?
No.
Are you feeling how would you describe your pain? Is it like a sharp pain on the outside of your elbow? Are there any specific movements? You said holding a cup. Is there any specific movements that make it worse?
Well, swinging my golf club and I move my arm just one.
Okay, so nothing like just generally, like moving your wrist up or down or anything like that?
No.
All right, that should be it here. I'm just going to summarize everything. So you are 65 years old, Bill. What's your last name?
Hinge.
All right. It's your left elbow that you're having issues with. You played 2 rounds of golf 3 days ago, and you have warmth and swelling, 9 out of 10 worst pain. You cannot tell me your current pain or pain at best at the moment. You like to golf and swim, unable to because of pain, and holding a coffee cup is currently giving you issues right now due to pain as well. Rest makes it feel better, and your goals for physical therapy are to be pain-free and all the things that you like to do. Is there anything else that I didn't cover or I said incorrectly that you would like to provide for me?
No, that sounds correct.
All right. So I'm thinking it's probably lateral epicondylitis due to the, which is often injured in people who play golf. Tendinopathy of the extensor mass tendon as it enters into the lateral epicondyle. He also mentioned that there's posterior pain, which could potentially be triceps tendon pathology. So it could be tendinopathy there for the triceps tendon. So I'm going to try to determine what that is. So I'm going to do a few exam steps here. The few that I'm going to choose will be, let's see here. I'll do palpation for condition. I'm going to do I do want to do Mstt, which could lead or defer MLT and MMT. I will want to do palpation for tenderness. So at that point, all right, so now I'm going to do special test as well. There's 2 special tests for lateral epicondyle. So I'm going to do special test. I believe special tests go before PFT. And it also helped me roll out MCL, even though it's not one of my first things. And I could also do a couple of special tests, like the Tenel sign medially. Good. So I'm going to do the Mills and Cosines test. Okay, so I'm going to do my first exam step of palpation for condition. So first I want to do a screen. Well, first, before I do the screen, I want to get your vitals. So I would get blood pressure, respiratory rate, and pulse. Once I get that, I want to do a screen. So I want you to have your legs off the table. Okay, so then what you do is to bring right arm up, left arm up. Good. And then I'm just going to have you ramp your right arm. Some pressure here, same thing over here. Good. And then have you bring your arms up overhead. Good. Apply some lower pressure here. Good. And then have you bring your arms back. Good. Do you have any pain with any of these?
Nope.
Just apply some lower pressure here. Good. And have you kind of just go in and out. Good. If you can kind of reach behind your back. Good. And kind of push out and kind of push into your back. Good. Do you have any pain with any of those motions? Good. Then have you, so I'm going to see your wrist then. So I'm going to have you just kind of go down, go up. Good. And have you kind of your fingers in and out. Tuck your fingers in. Good. And just go like this. Good. Okay. So no pain with any of those things? Yeah. Okay. So then I'm going to do palpation for condition on your left side. First, I'm going to do it on your right side, on the affected side first. Right. Okay. So, let's see your elbow here. I'm just going to kind of feel for temperature changes, see if there's any warmth, observe for any swelling. Look around, see if there's any increased muscle bulk or tone. Come over here, do the same thing with the mental note of things that I found on the unaffected side. So I'm assuming I would see some warmth, some swelling, some maybe some increased muscle bulk or chemical guarding. So, yes, I'd like to see the findings.
So, what do you want to know first?
Palpation for condition.
Did you do a screen?
I just did the screen.
Okay.
What does the screen say?
It says shoulder ARM normal, not painful. Wrist is in this big chart.
What do you mean wrist is in the big chart?
It says wrist info in the chart.
And around chart. Okay.
I'm going to tell you all this right now. No, because you didn't do that.
I didn't do it, so I don't think I would.
Well, I asked you about screening. You said yes. Okay, whatever. Palpation for condition, warmth and swelling noted over left lateral elbow. Ow, fuck.
So you said warmth and swelling of the lateral elbow, right?
Yes, warmth and swelling over left lateral elbow. Swelling noted circumferentially over radiohumeral joint lines of the elbow.
Circumferentially. Over, say it again, over what?
Radiohumeral joint lines.
Radio.
Centimeter greater on left than right.
So moving on to MSTT. Okay, so I need to see your right arm. Can you please pull up your sleeves again? Okay, so I'm gonna do some tests here. So I'm gonna have you just gonna bring your hand like this. Definitely. Good. So I'm gonna have you just resist. I'm just gonna resist some of that. Good. I'm gonna have you come up your elbow out. Do that. No, not like that. Open up your wrist. Yes.
You said bring your elbow out.
Yeah, go back to neutral. Go back to normal. Go down to gentle. Good. So I just want you to actually just match my force. Come on. Same thing over here. So now what I want you to do is, so I want you to match my force upwards like this. That's my biceps. This for brachialis. This for brachialis. Excellent. Now I'm gonna have you push down with my fingers. Match my resistance. Excellent. So I've done MSTT for pronation, supination, biceps, brachialis, brachioradialis, and triceps. Then I'm going to do it also for wrist flexion and extension. So what I'm going to have you do is I'm going to try to just have you move your wrist down and just match my resistance here. Okay, 1, good, 3. Excellent. And now I'm going to have you move up, match my resistance. Good. And maybe kind of move your wrist out. Good. Move your wrist in. Good. So that's MSTT. For you, tell me the findings. So I've done wrist extension, wrist flexion, and radial deviation, ulnar deviation as well.
Strong and painful for extension of wrist extension and middle finger extension.
Strong and painful for
Wrist extension, middle finger extension.
extensor, curvae, radialis, longus, gross. Okay. Is that it for the MSCT?
And it says NLT after it in the same line.
Okay. So if it's strong and painful, that means I can do MLT, but I cannot do MMT. So you defer MMT for anything that's painful. If it's strong and painful, you can do MLT. If it's strong, if it's weak and painful, you do not do MLT. If it's weak and painless, you don't do MLT as well. So since that's strong and painful, I'm going to want to dive deeper and do an MMT. Sorry, do an MLT since I'm going to be deferring MMT. So MLT of MLT of extensor carpi radialis. So extensor carpi radialis, brevis, and longus. So I'm actually going to have you grab a chair. So I'm going to have you sitting here.
Oh, it's really good.
You can't see. Okay, well, hopefully this helps a little. Okay. So I need you to, yeah, that's fine. So for MLT, I'm going to, actually, if you could scooch forward again, please. I need your arm kind of off the table a little bit. Okay.
I'm trying to hold it for you.
So for MLT, I'm going to do the extensor carpi radialis and extensor carpi radialis brevis, right? Longest and brevis. So what I'm going to do is I want you to flex your hand down like that. Good. So what we're going to do is we're going to go down, and then we're going to ulnarly deviate. So extensor carpi radialis does extension and radial deviation. So we want to do the opposite. We want to do flexion and ulnar deviation. So I'm going to, I'm actually going to palpate your lateral epicondyle, take you into flexion. First, it actually attached distally. So I'm going to do extensor carpi radialis longus. I'm going to flex the index finger, flex the wrist, and then ulnarly deviate. That's for extensor carpi radialis longus. Then for extensor carpi radialis brevis, I'm going to do both finger flexion, wrist flexion, and then ulnar deviation. Those are MLTs of those two muscles. I guess I can do a couple more. Just do more of the extensors. So I can just do extensor digitorum. So I can just flex all of the fingers and then go into wrist extension, wrist flexion. And then again, I'd want to ensure that the elbow is extended for this. Let's see. Yeah, that's enough for me. So that's MLT. If you could give me the information for MLT, that'd be great.
Pain with MLT wrist extensors at 65 degrees flexion.
Pain, wrist extensors. You said 60 degrees of flexion?
65 degrees.
Oh, wrist flexion. Actually, I just want to actually do the going measurement, get that rep in. So if you could come back over here, is that the only finding that you found?
Yeah. Well, yeah.
For MLT? I need to make sure I do a going measurement. So again, we flex the fingers, flex the wrist, and then ulnarly deviate. So I would measure wrist flexion and make sure that the wrist is properly off so I can there we go. So I would measure wrist flexion either on probably the lateral aspect. So I would do the ulnar styloid with reference to the ulna, and then the moving arm is in line with the fifth Mstt. Okay, so that would be 62, 63 degrees of wrist flexion. Good. So we've done we've done PFC, we've done MSTT, we've done MLT, we've deferred MMT, and now I want to do some special tests. So I'm going to do Cosines and Mills. So Cosines is, again, I'm going to have you, okay, so for this, it's actually going to be pretty similar. So Cosines, if I remember correctly, it's where you flex the wrist, flex the fingers, and while palpating, of course, I'm doing everything on the right side because you do the unaffected side first, but for all of this, I would be doing it bilaterally. So flex the fingers, flex the wrist, while palpating the lateral epicondyle, which is the origin of these extensor muscles. So then if it reproduces pain, that would be a positive sign, which is likely positive for a special test. Then for Mills, it's where you take them into slight extension of the wrist. You palpate the lateral epicondyle again, and the lateral epicondyle, or the extensor mass tendon. You ask them to resist wrist extension, wrist flexion, I guess. If there's pain and or weakness, that would be a positive test for both Cosines and Mills.
Positive Cosines, positive Mills.
Special test. Positive Cosines, positive Mills. Okay. Is there anything else special test wise that I should be aware of? Other special tests?
Mm-hmm.
What is it?
Remember, I can't hold my coffee cup.
Okay.
Grip strength.
That's not a special test.
Yes, it is.
So it just says grip strength is weak?
It says positive grip strength on the left with pain, 40% less strength on the right.
Okay. Is there anything else?
No.
Then, so positive Cosines, positive Mills. So we've done PFC, palpation for condition, muscle selective tension testing, muscle length test, special test, and palpation for condition, palpation for tenderness. So that's sort of similar to what we've done for the special test. I'm just gonna see. I need you to roll up your sleeve again. So I'll be palpating the lateral epicondyle, be palpating that. I'd be palpating the extensor mass tendon. I would be palpating forward, maybe even just some of the muscle belly of the extensors right around here. And I'd be palpating just above the lateral epicondyle as well as some muscles attached to that as well. What are the findings with palpation for tenderness, PFT?
Pain with moderate depth over ECRB insertion.
Palpation for tenderness. Pain with moderate depth where?
ECRB insertion.
Extensor carpi radialis brevis.
Into the lateral epicondyle and the muscle belly.
To lateral epicondyle and muscle belly. All right. Following all of that, I'm thinking kind of confirms everything that it is kind of confirms my initial hypothesis of lateral epicondyle. So, lateral epicondylitis, which is a tendinopathy of the extensor carpi radialis brevis and other extensor muscles of the wrist and forearm. So, I would treat this conservatively at the beginning, since this is only 3 days out, so this is more of the acute phase to subacute phase, but since it's getting worse, I'd say it's the acute phase. I'd want to apply some ice, and maybe do some effleurage to help get some of the swelling out of the way. I would Also, maybe I could work on some strengthening if I felt like that was appropriate, maybe in a pain-free range, since wrist extension is painful for the patient. Maybe I'll do some isometric strengthening, maybe it's just some pain-free exercises there. Maybe do some E-stim, IFC to help with pain management as well. But at this point, we definitely want to kind of do some of the RICE. So rest, ice, compression, elevation, get rid of some of the swelling and warmth and decrease the pain. Maybe even suggest, if the patient needed it, maybe some non-steroidal anti-inflammatories to help with the pain and swelling as well. I would provide patient education that the more patient flexes and extends the wrist, the more aggravated the tendon is going to be. So I'm going to try to keep the wrist in pain-free ranges until the pain and swelling and warmth subside. And then I'd educate on the patient on staying away from golf for next week or two, if not more than that, if needed, to help avoid and swimming to help avoid increased pain and swelling. Try to get us out of the acute phase and in more into the subacute phase. So once we get into the subacute phase, I'm going to do more maybe some Therex neuromuscular rehab by kind of maybe working on catching a ball, maybe squeezing a ball, like a squeezy medicine ball, to kind of help with his grip strength, since he's having pain while holding a coffee cup. That can maybe replicate that. I can also maybe have him, like I said, have some throwing and catching of a small ball. Have him maybe pick up some rocks and put them in a cup, and then take them from the cup and put them out of the cup, and maybe create some designs. What else? If there's still some swelling or warmth, we can address that with some ice, maybe some range of motion exercise to get some of the blood flowing. Maybe some wrist pumps if it doesn't provide too much pain for the patient. If needed, we could do some TheraBand strengthening. What else? I don't think I would need to perform any manual mobilizations to this patient at this time. And then the home exercise program, I guess I could do maybe some grade 1, grade 2 mobilizations to help with pain and neurophysiological effects, and help calm the patient a little bit. Then for home exercise program, I would kind of just again, it was kind of tied into my patient education, explaining to them that at home, try to avoid some aggravating motions, and I'd probably give them kind of a stress ball for when they progress further into the plan of care, to help with some strengthening, maybe some putty or some Play-Doh. Also home exercise program, I'd educate them to ice 2 to 4 times a day for 15-20 minutes, and elevate the elbow above the heart to help with blood circulation, to get the blood out of there, the swelling out of there. Stage of condition is acute, like I said. Tissue reactivity is, I would say it's high at this point. I guess with the MLT, I am able to get to end range, so I guess maybe it'd be moderate. I guess I'm going to go with moderate tissue reactivity, since I am able to get to end range, but there is pain at end range. And then subject reactivity, I guess I would say that it's high for playing golf and swimming, since the patient cannot perform those activities due to pain. But I would say it is moderate for some household activities like holding a cup of coffee, considering the patient can perform those, but they are experiencing pain. Can't think of anything else that I would need to talk about. That is it.